mpox cases now stands at 19 from an initial 2 cases recorded about a month ago. The Ghana Health Service on Monday reported 10 new cases. Director of Ghana Center for Infectious Diseases, Dr. Joseph Oliver joins us. Oliver Comey joins us. Thanks for joining us this morning. Should we be worried? Should we be concerned, Doc? Oh, did I lose Doc? We'll try and reconnect, but I'll just give you an update on the mpox cases whilst we try and reconnect with Dr. Joseph Oliver Comey. He is Director of Ghana Center for Infectious Diseases. And so currently, as of yesterday, 26th May, the data showed that 10 new confirmed cases, totaling to 19 confirmed cases. When it comes to deaths, of course, no, we've recorded 0 deaths and total deaths as well. New deaths 0, total deaths 0. But the 5 out of the total confirmed cases are on admissions, and we're trying to figure out, or we're trying to connect with Dr. Joseph Oliver Comey to find out how serious those who are on admission are, how are they responding to treatments, and the sharp increase to 19 is quite a lot. But let's try. Doc, if you can hear me, should we be concerned before we go into the figures? Should we be worried?
Thank you very much and good morning. You shouldn't be worried at all. Once we are looking for cases, definitely we'll find them.
Okay.
So we need not be worried at all.
Okay. Let's start with the 5 who are on admission. How serious is their condition?
In fact, for mpox management, we could either do home care or inpatient. Once home care is not available or it's not a required method, then we will admit. So I must say that even those on admission are not very sick, but because their home environments are not safe, that is why we are keeping them on admission. So they are not on admission because they are very sick, but they are on admission because home care is not suitable for them.
Okay, let's go to the numbers. That's sharp, 19 so far. What has accounted to the increase in number?
So we think that the increase in numbers is because we are looking for the cases. Currently, almost every region has sent samples as suspected. So you could have close to about 118 suspected, and then 19 confirmed from 6 regions. Some of the lesions or some of the people are presenting almost a week and a half after the rush began. Either two, they wouldn't have presented because they didn't see it as much as a problem. But because we are talking about mpox, they came forward for us to check whether they also had mpox, and they turned out to be mpox.
Okay.
So the numbers have gone up because we are actually looking for the cases. And then there's a lot of public education. And it has been more or less destigmatized. So people are coming forward for assessment.
Okay, Doc, so this 19, are they closely related in any way, or these are separate individual cases?
I think close to about 90% of them are not related. Okay. We've only had one contact of one person becoming also symptomatic during this period. So just one contact out of all the several contacts that we've had. Okay.
Which one of the regions is presenting to be more likely to have high numbers so far?
Currently, the Greater Accra region and the Western region seem to have the highest numbers.
Okay. Greater Accra, I won't be surprised, but Western region?
Yeah, Western region, you shouldn't be too surprised about the Western region.
Okay.
Looking at the communities from where we are getting some of the cases, we're getting mainly from the mining communities. So if we talk about a disease being a disease of contact, you should know that most of these mining areas, there are times that the people are not living in, let's say, proper homes. So maybe they are sharing utensils, they are sharing sponge, they are sharing towels, and then we are getting contact from some of these cases.
Right. Beyond you searching, You're not waiting
Hello?
for, beyond you searching, I'm sorry that I lost Doc again, but if we're unable to reconnect with Doc, we will try and connect with him in our subsequent bulletins to at least get more information. Whilst you are listening and watching, you want to stay out there and practice all the safety measures so that you do not come in contact with any of the lesions as well. But you're